I'd like you to think about a simple question as you watch this tape. Are you happy about the direction that medicine has been going in the past few years? We're betting that the answer is no. So what are you going to do about it? Unfortunately, many doctors think now that the best they can do is go along to get along, struggle to do the best for their patients, and maybe think about retiring early. Some doctors refuse to accept the politics and the rhetoric of defeat from organized medicine. Now, if you're one of the doctors that thinks it's time to reclaim your profession, I think there's a group out here that you might want to take a look at lending your support to. The group is called the Association of American Physicians and Surgeons, and they've been called recently by a national news organization a different type of doctors group.
Every physician in this country should join if he has a tremendous love for his personal freedom to treat patients as he feels is in their best interest.
This organization gives me an opportunity to share with other professionals who are not afraid, who believe in the oath of Hippocrates, who are concerned about their patients.
Many of the physicians seem to have given up. There was a lot of despair, and there was demoralization among the doctors, and almost like a feeling like there wasn't much left to do but just go on and survive. And I became introduced to APS, and suddenly I realized there is still one group out there.
When I first joined APS, it was for one very good reason. And that reason was that I wanted to be part of an organization that would act, and one was not paralyzed by fear.
You know the practice of medicine, particularly private medicine, is under attack. Government bureaucrats dictate necessary treatments. Managed care plans want you to pledge allegiance to their plan rather than to your patients. And government agencies issue confusing regulations that make the IRS rules look as simple as a recipe for a boiled egg.
There are now an incredible 132,000 pages of Medicare regulations. People think they have it bad with the IRS, but there are only 17,000 IRS regulations.
Doctors are capriciously prosecuted for violating ever-changing regulations, resulting in financial and professional ruin.
My surgery center was decertified after being certified for 15 years without cause, without any changes in my surgery center. And I was flabbergasted to learn.
And it doesn't seem to matter anymore whether you're guilty or not.
We have a very troubling system because it does a couple of things. Number one, it determines and often considers doctors guilty until proven innocent.
You and your staff spend more time on compliance than on patient care. A survey by AAPS shows that Medicare paperwork alone takes up almost 1/4 of your time. On top of all that, national health care is not dead. You may have thought that government medicine was pronounced DOA in 1994 with the defeat of the Clinton plan. But think again. Since then, Congress has passed numerous slices of the government health care salami: kid care, national patient IDs and database, national provider IDs, increased criminal penalties for doctors, and expansion of Medicare is always on the table. The latest idea is to lower the age to 55. Now, supporters call it universal access to health care. AAPS calls it what it is: socialized medicine, government rationing, which is neither necessary nor acceptable to Americans.
I think we'd already have socialized medicine if it were not for APS.
Many of you tell us that other medical organizations are not doing a good job sticking up for doctors.
Unfortunately, most medical societies just decided to go along to get along. But APS isn't like that. It really is out there fighting for what's right for the patient.
Other professional groups, they do what's convenient. They do what they can to keep their power, to keep their members.
They seem more interested in protecting their political clout and perks and those six-figure salaries for their leaders than representing their members or patients.
I was a member of the AMA back when I had the perception that the AMA was really trying to represent all the physicians in the country. But once the AMA started trying to represent special groups within medicine and forgot about me as a physician in my practice, I said, they don't represent me anymore.
The AMA is the government's biggest cheerleader. Well, you can understand it. It needs to protect its exclusive contract for the CPT codes worth millions of dollars. Well, the records are clear. The AMA makes much more money from its publishing than it does from member dues. So how can it truly represent you?
I belonged to organized medicine for over 40 years. When I finally realized that the AMA and the other organized groups that I belong to were not really interested in me or my patients.
Other groups say flat out that medical care is a right, a question of social justice, and want to take us down the road to government-controlled socialized medicine like England and Canada.
I think medicine has gone too far to the left in too many circles that it's time to bring it back home.
Since 1943, AAPS has been the only national association of physicians in all specialties dedicated to preserving and protecting the sanctity of the patient-physician relationship. Old documents show that there were some basic differences between AAPS and other groups from the start. First, the founders emphasized that the AAPS was to function as the conscience of the American Medical Association. Second, AAPS was to take no financial support with any strings attached. And third, AAPS doctors would be dedicated to the oath of Hippocrates. The AAPS motto says it all.
This is such a breath of fresh air of people with like minds who can articulate a vision for American medicine that I think is really true to the oath of Hippocrates.
AAPS members believe this patient-physician relationship must be free from all third-party interference, whether that's from the government, insurance company, or healthcare plans. Patients should be free to hire and fire their plans. It comes down to this: whoever buys, controls. And for the most part now, employers or the government buy health care, and patients are removed from the real costs.
What we need to do is have the person receiving care involved in paying for the care so that they can demand the type of care that they want.
AAPS is working to make all health care premiums tax deductible and supports medical savings accounts. AAPS isn't afraid to take on the government if that's what it takes. It successfully sued the Clinton administration, forcing it to produce all the secret documents of the illegal operations of the President's Health Care Task Force. And in 2001, AAPS again sued the government to stop implementation of new federal privacy rules that violate patient confidentiality. AAPS has led the fight to defeat AMA implementation of E&M guidelines. It's defended numerous doctors from capricious prosecution.
We went into medicine to take care of people. We didn't go into medicine to follow 132,000 ridiculous regulations.
AAPS blew the whistle on increased criminal penalties on doctors in the HIPAA Act of 1996 and has managed to delay a national patient database and the IDs authorized in that same bill. Also, AAPS was instrumental in the 1997 legislation that established the right to Medicare private contracting.
I think we've had some excellent speakers. I also think there's been a good deal of diversity.
AAPS sponsors seminars in economic, legal, and political issues, such as the latest in practice management strategies and how to opt out of Medicare, or maybe how to defend yourself from an audit or prosecution. Seminars are kept to affordable rates and carry CME credits. AAPS advises legislators from City Hall all the way to the Senate up on Capitol Hill. AAPS doctors testify before congressional committees and regularly meet with members of Congress through the Washington, D.C. office. There are even members of AAPS in Congress. AAPS gets its message out through the national and local media. Places like Nightline, the Wall Street Journal, the New York Times, the Rush Limbaugh Show, and the Washington Post. In fact, one talk show caller, though critical of AAPS, admitted that he was dismayed at the amount of positive publicity for the group.
People seem a lot more open and, you know, just like more like a team, I guess.
AAPS has distributed tens of thousands of patient education tools, such as the RX for Patient Power, the Patient's Handbook. AAPS has built a grassroots network of informed patients by working with citizens groups, seniors organizations, consumer advocates, and taxpayer groups. Thousands visit the AAPS website every month, a resource of hundreds of pages.
I don't know why more doctors are not members of this organization. It wasn't expensive to join, as you know.
Now, if all of this isn't enough to convince you that you belong with AAPS, there are some terrific membership benefits. You'll receive a monthly newsletter packed with the latest information on regulations, policy, enforcement, and court cases, including a legislative update. AAPS reviews hundreds of sources, so you don't have to. You'll have free access to the AAPS Limited Legal Consultation Service to provide you with answers to questions on a wide range of legal issues. One phone call could be worth the price of your membership. You'll receive the nationally acclaimed peer-reviewed journal, The Medical Sentinel, that publishes the stories and studies you won't find anywhere else. At the annual meeting, you'll network with AAPS members and meet with nationally recognized experts on medicine and public policy in an intimate setting. Past speakers include members of Congress, presidential candidates, and media leaders. You'll receive alerts and talking points about legislation and regulations so you can take timely, targeted action. AAPS provides many patient materials. They'll send you action alerts and educational materials ready for distribution to your patients. You may be eligible for membership in an AAPS state chapter, each with its own benefits, such as professional liability insurance and legislative access to your state capital. And 90% of your dues are tax deductible.
Since I've been in the organization over a long time, where there have newcomers, and we have younger people coming in, and that I think is absolutely the key.
For more information on AAPS, call 800-635-1196 or check out the website at www.aapsonline.org. It may be the best professional move you've made in a very long time.